Our next guests are teaming up to help reach conservative Americans who may have lower confidence in the vaccine, according to recent polling. Joining us now, former governor of New Jersey, Republican Chris Christie. Also with us, a senior scholar at Johns Hopkins Center for Health Security, Dr. Amesh Adalja. Dr. Adalja, just overall broad view of vaccine fear. What are we seeing in terms of the ability to get the vaccine to the American people? And do we have any sense of how many people are refusing it?
I think it depends upon which survey you look at, but there are a substantial group of people that will not get the vaccine under any circumstances. And then there are people who are very enthusiastic about the vaccine. But in the middle, there are many people who have questions about the vaccine, want to learn more about the vaccine, and have basically an informed decision with their doctors, with the other healthcare providers. And I think that's the group that we're really trying to reach, because those are the people that are taking their health into their own hands, trying to understand this vaccine and learn about it. And it's going to be very important to have data for them to be able to make informed decisions and get vaccinated.
And do you think, doctor, that in some ways there may be still some mixed messages out there, perhaps that they have heard either from the previous administration or Republicans or whoever is still sort of a vaccine sensitive or against masking?
There definitely have been a lot of mixed messages and misinformation out there. And that's why it's important to have good sources of data to be able to trust, to learn about the vaccines, to learn about mitigation measures with COVID-19, to know where the trajectory of this pandemic is going. And I think when you look at these vaccines and you look at the data, you really only get more knowledge and more power to make a good decision, because these vaccines are tremendous at stopping serious illness, even stopping symptomatic illness. And this is a key and important way to really move through this pandemic and to be able to engage with people again, to be able to partake in those activities that so many people have not been able to do. And I think when you look at the story of vaccines, it's really a story of life enhancement, that vaccines change your life. And I think this one does.
Chris Christie, so tell us what brought you to join this campaign. We all know that you had COVID, went through it, even went to the hospital and received experimental treatment. Did they work? Did they save your life? And why do you think this campaign is so important?
Well, good morning, Mika. Good to see you again. And I will tell you this, that there's no doubt in my mind that the Eli Lilly antibody cocktail played a role in saving my life. And I think for all the people out there who have some questions and questions that most people would have about the efficacy of any kind of new drug that comes out on the market, I'd say this. This is the most random virus of our lifetimes. Think about it. I went into what was supposed to be the safest place in America, the White House, where I was getting tested every day before I went into the White House for 4 straight days, and that's where I got COVID. So there is no safe place from the virus. That's the first thing. And the second thing, Mika, is the randomness of the way it affects people. Just recently, in the last 3 to 4 weeks, I had a 62-year-old cousin who no prior health issues at all. She and her husband both got COVID. They both were hospitalized. They both were ventilated. My 62-year-old female cousin died of complications from COVID, being intubated, and 6 days later, her husband died as well. He was a healthy longshoreman working on the docks here in New Jersey. So it is random in how you get it. It is random in how it affects you. And the vaccine is like putting your safety belt on when you get into the car. It's not going to guarantee you 100% that if you got in a car accident that you wouldn't be killed. But let me tell you, it makes it much, much, much less likely. And that's what we need to be thinking about.
So, Chris, talk to me. You talk about the White House being the safest place. I do want to ask you if you could share with our viewers who may have the same mindset as to why you felt safe going to events, the nomination ceremony, the debate preps, not wearing a mask, when the science was out there. But what was it about your understanding of the virus that still had you putting yourself at risk? And I don't say that in a judgmental way. I say it in a way that I'd like you to speak to the people who are doing that now, who are going out to restaurants and bars and feeling they're safe because maybe they're outside, but they're not social distancing. Because the White House wasn't safe. People were getting coronavirus. But there was a group of people who gathered at the White House consistently at events like these who also felt comfortable. Why?
Well, I think the biggest reason, Mika, was that the way it worked when I went to the White House, at least, for all those days leading up to the debate prep, was that before you could go into the West Wing of the White House, you were immediately brought to the medical unit beforehand. You were given a test, and you had to stay there and wait for the results of the test. And everyone that I was interacting with had been tested. So the thought process was, well, if everyone's been tested and everyone's negative, well, then you should be fine to be in there.
But hold on, Chris. The rapid tests, we all know, and we had known then, the rapid tests are not conclusive. They're not as conclusive as perhaps a test that you go and send to a lab. So everyone's getting rapid tested does not mean everybody is negative. And we know how it spreads.
Mika, listen, I've already said, that me not wearing a mask was a mistake. And the proof of it being a mistake was that I got COVID and I was in the intensive care unit for 7 days. And so it was a mistake. And I think, the Ad Council put out an ad that I did back in December that got a lot of attention in that regard. But I'm telling you why. You asked why. That's why. That's why people thought it was safe. Why I thought it was safe. And what I'm trying to emphasize to people now regarding the vaccine is my personal story, which is I had worn a mask for 7 months before I went to the White House and had remained healthy. I believed I was okay without a mask in the White House. I was wrong. Now, we have to remember the randomness of how this disease spreads and the randomness of how it will affect you. Yes, there are certain indicators that would make more people vulnerable than others. But as I just told you, I had 2 cousins who died in the last 4 weeks, who neither of them had any pre-existing conditions. And one of them died from organ failure because she couldn't breathe. And the other one died because he had a brain bleed that was related to this. So he was, as I said, 62 years old, working on the docks as an active longshoreman in great physical condition, working a physical job every day. So what I want people to understand is that, yes, there are things we know about this virus, but there's lots of things that we still don't know. And getting the vaccine is a way to severely reduce your likelihood of getting seriously ill from COVID, and in many cases, from getting COVID at all.
Governor Christie, it's Willie Geist. Good to see you. It's been a long time. I knew you had a hand in this campaign when I saw the Pete Alonso swing in that ad. I knew you snuck that in there for the Mets. Let me ask you, though, there is, as you say, there's so much garbage floating around online. There's so much out there that masks actually might be bad for you, that vaccinations are bad for you, that it's a big scheme for Anthony Fauci to get rich, whatever the conspiracy theories are out there. And you know Donald Trump well, you know the former president. Do you think it would be powerful if he came out in a clear way and said, look, I got the vaccine back in January. I didn't do it publicly. Maybe I should have. I did get it. You should go get it, too. There's nothing to worry about. I feel fine. I had no effects from it. Wouldn't that make a big impact on the 74 million people who voted for him?
I don't think it would, Willie.
Really?
And I base that on having participated with Frank Luntz and others in a focus group of folks who are Trump voters and who were reluctant to get the vaccine. And their message was that they didn't want to hear from any politicians about why they thought they should get the vaccine. What they wanted to hear, if they're going to hear from anybody like me in public life, was their own personal stories that might be able to help them understand why this was a good thing to do. It was very, very interesting, Willie, the focus group, and it was without regard to party, whether it was Barack Obama or Bill Clinton or whether it was George W. Bush or Donald Trump. They quite frankly didn't care. That wasn't moving them. But what was moving them was hearing about the randomness of this disease, hearing about how we think we know which people are more affected, but that others randomly get affected and lose their lives as well. And so, listen, former President Trump has publicly said that, he took the vaccine, it's safe, and he thinks you should too. But I will tell you, I think that moves the needle very little based upon what I saw from this very powerful 2-hour, focus group that we did. And I think these are for people from all over the country, different ages, different regions, both genders. and they were unmoved by it.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.